Welcome and thank you for joining us for this webinar presentation. We are the Homeland Defense and Security Information Analysis Center, or HDIAC, one of three IAC domains in the DoD Information Analysis Centers operating under the Defense Technical Information Center, DTIC, within the Office of the Undersecretary of Defense for Research and Engineering. Our informative webinar series highlights current and emerging research and technology developments. It presents an opportunity for accelerating the DoD's leverage of these advancements by increasing awareness and fostering technical collaboration. HDIAC serves as one of the premier information research partners and curators of technology advancements and trends for the Homeland Defense and Security community. As such, our organization supports those working in the Homeland Defense and Security domain of DoD research and engineering. We do so by helping navigate the vast landscape of scientific and technical information, allowing our customers to get a head start on their technical projects. With an understanding of the Homeland Defense and Security DoD research and engineering landscape, we provide research and analysis services. We help unlock access to information, knowledge, and best practices from government, industry, and academia to stimulate innovation, foster collaboration, and eliminate redundancy. We hope you enjoy this webinar presentation and that it serves as a catalyst for community collaboration and improved DoD Homeland Defense and Security research.
Hey everyone, thank you for joining this webinar presentation. My name is Philip Payne. I am the technical lead for the Cybersecurity Information Systems Information Analysis Center. I am your guest host today for this HDIAC webinar. But before we get started, I just want to note a couple of administrative items. First, if you are dialed in by phone and would like a copy of the slides, they were posted to the HDIAC webinar announcement. You can go to our website /webinars and find today's webinar. When you click on it at the bottom of the announcement, it will say download presentation. Second, all participants are muted, but feel free to chat using the attendee chat window on the lower right-hand side of the webinar screen. You can use that to chat with each other, and I'll be monitoring that chat during the presentation. However, if you'd like to pose a question for the Q&A session at the end, please click the three dots labeled More/Panel Options to bring up the Q&A window as part of your layout. At the end of the presentation, I'll go over the Q&A. For the benefit of those over the phone, I'll read the questions out loud to the presenter. If you have any technical issues today, please have no fear. The full presentation will be available online. Please check back to the HDIAC website once the webinar is posted. The Go To Webinar button will take you to the recording at our YouTube page. With that said, I would like to introduce today's presenter, John Clements. John is the technical lead for the Homeland Defense and Security Information Analysis Center. He enlisted in the U.S. Marine Corps Reserve in 2001 and continues to serve as the Regional Contingency Engineering Management Chief for Marine Forces Pacific. He deployed 3 times to Iraq in support of Operation Iraqi Freedom. His prior work includes test and evaluation on procedures and systems related to chemical, biological, radiological, and nuclear decontamination, mortuary affairs, cyber insider threat, open source, and social media information, the common operating picture used by combatant commands, and the mounted computing environment. He has extensive experience working with joint interagency and allied partners at the strategic and tactical levels. Mr. Clements holds a Master's of Arts degree in Homeland Security from the American Military University. John, take it away.
All right, thank you so much, Phil. Thanks for guest hosting this. And thank you, everybody, for dialing in today. I really appreciate it. So the title of this webinar might be a little bit of a misnomer because it's not really about forgetting to inform the public. That is part of every emergency management agency's mission, is to ensure that the public is informed. There's usually a public information officer or public affairs officer who routinely practice this and in exercises. But what I started to notice, or what I have noticed, and many people have noticed, I think, is that sometimes the messages, and not just from the government agencies, I don't want to alienate a lot of the emergency management folks that are on the line, but not necessarily just from them, but the holistic thing from industry when there's an issue, or anyone that is managing a crisis. there seems to have been a little bit of a lack sometimes of understanding how the message is going to land to the public. So to um, slides are not advancing. There they go. So just to give you an idea, if you're not familiar with HDIAC, the Homeland Defense and Security Information Analysis Center, uh, we are a DoD-funded center that falls under the DoD IAC program and operated by the Defense Technical Information Center. So I say that to just let you know, I'm a researcher. We are researchers here. We are not an emergency management agency. We are not a public information consortium or anything like that. Me personally, like I said, I am a researcher. So I just started to notice that disconnect between the intended message and the one received in many, especially the larger scale uh, crises or issues that cropped up through the course of research that I was conducting and exercises that I was hosting. So some of that research includes the infectious disease response. So worked on a program in which we um, uh, analyzed future responses of managing infectious diseases in the homeland by the U.S. Army specifically the Army, not the full DoD. In that, we found a lot of the responses and some of the problems with messaging and communications from the COVID-19 response and other public health crises that have cropped up. And so it became clear that even despite the best efforts of public information officers, sometimes the message wasn't landing. And so we will discuss some ways that are surely more difficult and involve more effort, but that may be a path forward for those individuals. We also have done a lot of research around nuclear energy and a lot of the misconceptions around nuclear energy, which again isn't really a problem with the messaging, but it is a problem with people's perceptions. And won't really talk about it too much um, in this presentation, but yeah, that the messaging there has been an issue, and there's a large counter messaging movement out there now among people who support nuclear energy as the future of clean energy. And then, of course, some natural man-made disasters. And we'll talk about at least one of them here in this report. In addition, I've helped host and facilitate some exercises, a couple in migrant populations, both in previous work that I had done and also currently through HDIAC. We have been hosting an exercise on managing public health in a migrant type of crisis. And so much of that falls back on what is the message you're giving to the population, but you need to understand the population you're dealing with. Comes to especially in the military environment, since we are DoD funded, you may be operating in an area where the cultural sensitivities are vastly different than what you're used to here in the United States. But even here in the United States, if if you are a emergency manager in Pennsylvania, working in Philadelphia is vastly different than working in, say, Center County, where there's more deer than people, but you still need to assist those people that may be affected by something. And then, of course, or I should say, of course, but also did some work with civil affairs folks, designing processes to gauge sentiment. So to do sentiment analysis, and that is pretty interesting. How you can use social media and things like that to gauge the sentiment of a population in a geographical location. So that kind of colors some of my research and understanding. We won't really talk about it here, but that is something that could possibly be leveraged by emergency managers. And then, of course, in combat operations, managing certain things that might happen in there, and you have a local population that is involved, and just trying to keep control of the chaos there.
Hey, John.
Yes, sir.
I'm monitoring the chat. It's about 50-50. It seems that a decent amount of folks can't see the slides.
Uh,
Would it be possible for you to maybe stop sharing and then try again? If not,
okay.
then we can just keep you abreast of what current slide we're on. But
Okay.
we just started the presentation, so we're only on slide 2. So for those who could not see the slides, you didn't really miss much content just yet.
All right. Let's see. Oh, went too far. All right, I'm sharing again. So let me know if the people who couldn't see them before can see them. I did post the link directly to the website where the slide presentation is located. So if you're able to get to that, you can download them. You don't have to be logged in, I don't think, to download them. So if you want to go grab them, we are on slide 4. And slide 4 is a table that I pulled for another resource, but it was just a quick overview of the effects of misinformation in crises. And so, in a couple of healthcare crises, notably Zika virus, there was information overload in a short period. So that is the constant balancing act for emergency managers and for the public information people is you want to get the information out there, but it is very easy for people to get overloaded with that information. And so it's finding that right balance of informing the public, giving them the tools that they need, perhaps providing where they can find more information if they want to, but ultimately, here's what you need to do to deal with this. So it created a lot of confusion about the severity and the immunity and vaccines. And that ultimately it caused problems facing infectious diseases and putting health in risk. More arguably more impactfully is many of the anti-vax situations that have come up, and that dialogue that has shown up, especially in social media. But so there has become poor public confidence in vaccination, even though there is a lot of evidence that points to vaccinations wiping out many diseases that were debilitating to the population before. Polio, smallpox, and things like that are under control and eradicated in many cases because of vaccination. So now you have people in the population that are choosing not to get vaccinated, and they are exposing themselves to these diseases. So it has led to small outbreaks of in Europe, of hepatitis B in France, of H1N1, which avian flu in many countries in 2009, and then a 300% increase, triple the rate of measles in 2019. And so that becomes a major public health issue. And then the other thing is, on one hand, it's mainly impacting those that aren't vaccinated, but there's also many people that are immunocompromised, maybe for some reason can't receive the vaccine, who then are exposed to these diseases who otherwise wouldn't be. And so now you're putting these people who had no choice in the matter at risk. And so it's a difficult situation. When it comes to natural disasters, that is really, when I think of the importance of getting information out there quickly, that's what I think of. But there have been a couple of instances, notably Hurricane Harvey and Irma in 2017, where some false information was spread. It delayed the evacuation of people. And so in Hurricane Harvey, you see some of the details. There was a rumor that officials were asking immigration status, which led some people not to evacuate certain areas if they thought that they were going to be asked their immigration status. And even people who were citizens, natural born citizens, didn't want to be scrutinized by officers who might be coming up and asking for their immigration status. And then they ended up sheltering in place when they should have evacuated. And then Hurricane Irma is something completely different. A rumor started going around that survivors, people who stayed in their location and survived the hurricane, would receive generators from the government. Where that originated from and why that was. So some people chose to stay, and some people thought, "Hey, this is great. I'm going to get a free generator, and I can use that for all kinds of things." And it didn't happen. So, and then another great example is flooding in Louisiana, in which there's a lot of confusion between legitimate and fake information, and there was a major disruption, I would say, of people sharing things on social media and saying that, hey, FEMA is going to provide X, Y, or Z, but they were confusing FEMA along with the Red Cross. And so when they're contacting FEMA or they see FEMA representatives, they're asking about these services, and FEMA, some of the people on the ground didn't realize that they were thinking of the Red Cross. And so then it looked like the government promised something and didn't deliver, where it was just confusion. And again, there's not really a great way to manage that currently, but there are some things that could potentially be utilized that we'll talk about here in a moment. So real quick, we'll go over 3 different case studies and some of the messaging that came out from them. And those 3 will be a Kingston coal fly ash spill in 2008 in Kingston, Tennessee, the Mpox outbreak in 2022, and then a syphilis response by a county in West Virginia. Sorry if I butcher this, Monongalia County, in 2020, I believe just before and even during the early period of COVID-19. So for the Kingston coal fly ash spill, if you haven't heard of this, I hadn't until a couple of years ago, and I was kind of surprised at myself. But essentially, 5.4 million cubic yards of coal fly ash was released after a dike, which was holding it back, failed. And this led all that fly ash to cover approximately 300 acres of area surrounding the Kingston fossil fuel plant. It got released into the local rivers, and it outright destroyed homes and wildlife in the area. Though incredibly disruptive, and it was on December 22nd. So, right before Christmas. Not that it matters much what time of year your house gets demolished by coal sludge, but it just kind of exacerbates the situation a little bit. So some of the public messaging that came out from that was really became a master's class in what not to do. One of a TVA, so the Kingston plant is operated by the Tennessee Valley Authority. And I'm sorry, I'm on slide 8. The title of the slide is public messaging. Just realized there's no slide numbers here. Sorry about that. So slide 8, public messaging. Picture in the upper right-hand corner of the coal ash spill. So TVA, one of their spokesmen mentions, hey, until any analysis comes in, you can't call this stuff toxic. And so he was trying to downplay it, and I think in his mind he was trying to alleviate public fear. But the problem is that that went against science. People already knew there's already been research, and people knew either through that research or just through kind of almost common sense, I think, that fly ash contains hazardous materials. So for example, this 2005 study says that the fly ash is a hazard to the lungs through their potential to cause oxidative stress, inflammation, cancer, and has the potential to redistribute to other organs. So, and one of the quotes from the TVA spokesman is like, can't really say, and it's not toxic or anything. When you already kind of know the opposite's true, you're waiting on that analysis to confirm what is contained in there. But people for the most part knew that this was toxic, this was bad. And so this picture just is a kind of overview of an overhead view, I should say, of where the coal fly ash spilled. And you can see the locations of the rivers there. I believe that is the Emory River in Kingston, Tennessee, or just outside of the limits of Kingston, Tennessee, I believe. So, I mean, you just look at the color of the photo. The whole bottom half is pretty much black or gray, and that's all the fly ash. So we're dealing with a massive problem here, and the poor messaging just continued. So I'm on to slide 10, which is titled "More Missteps." So the CEO of the Tennessee Valley Authority kind of just referred to the disaster as an inconvenience. Again, playing it down. Meanwhile, dozens of homes have been destroyed, and he prematurely declared things safe. And tried to reassure people like, oh, nope, nothing to see here. Just continue to move along. And this was compounded by the fact that the senior vice president of the TVA for environmental policy called the coal waste inert. Now, what she may have been saying there is from a chemical reaction standpoint, it may have been inert or mostly inert, but the general public is going to hear inert and think that means safe. And that was definitely not the case. And so people questioned, why would you tell us that this is safe? So hard to decipher if she meant chemically inert or if she was trying to use just a synonym for safe. But again, the message just did not land the way she intended. And she described the event as a challenging event to restore the community back to normalcy. But the way she phrased it, a lot of people took that to mean like she feels that this is challenging for the TVA to manage and kind of discounting again the livelihoods that were destroyed, the houses that were destroyed by this event. And we already talked about the TVA spokesperson saying that, hey, this stuff is not toxic or anything, which immediately followed his claim that the analysis was not complete. So that's kind of contradictory, right? Well, there's no analysis, so it's not toxic. Well, how would you know it's not toxic if the analysis isn't complete? And so that just led to a lot of mixed messaging from folks. So moving on to slide 11, the effects. So some of the immediate effects, said a few times, dozens of homes were destroyed. Coal ash spilled into the local rivers and killed and displaced wildlife. And interestingly, there was an area where many fish were found on an embankment of the river. And here again, the messaging kind of played a role in that people have said, well, the fish didn't die from the toxicity. They died because the coal sludge hit the river so fast that it actually created kind of a wave that pushed these fish up onto the embankment. And it turns out that was probably actually true. There has been some analysis done of the fish, and it looks like they were out of the water too long, and they died from that. That kind of tells you how fast and how crazy this coal ash was moving. But by that point, the fish were not killed by the toxicity in the water. 300 acres were covered, and then TVA just lost. Their response was questioned from end to end, and their answers were just not satisfying the residents. So, more long term, one of the terrible outcomes of this is that TVA hired a company to do cleanup, and that part of it was that long-term cleanup was mismanaged from the occupational safety of the workers. So more than 30 cleanup workers have died, and most have been tied back to cancers and other lung issues, tying it back pretty conclusively to the coal ash spill. And more than 250 have become ill in some way. And the houses were demolished, and the area has been. They just turned it into a park. The houses aren't going back there. And so those people were forcibly relocated. Another interesting point, and I'll spend a moment talking about this, is the coal ash was relocated to an area, I believe in Alabama, but the area was a lower income area, and the population was largely minorities. And so in the surrounding area, I should say. And so I did not get to the level of detail of figuring out how the decision of where to move it was come by and who made those decisions and those sorts of things. But there was a large amount of questioning of, why was it moved here? And, why send it here? Is it because, now you don't care about this population here? And so it's just one of those things somebody didn't take a look at, or if people did look at it, they dismissed it eventually of, where we moved the coal ash to. And interestingly enough, it was fairly far away. It wasn't a large distance, a huge distance, but it was far enough away that there was, legitimate questions of why truck it this far? Why not put it somewhere closer to Tennessee? And so yeah, just those optics that some people dismiss. And so because of the short-term and long-term effects, TVA lost a lot of credibility in the eyes of the public. So moving to slide 12, this is just a picture, this is just a map. Kind of in the red, you see the area that was the time critical removal action. And so that was mainly the waterways and the immediate embankments surrounding them. And so that was the amount of area that had to be cleaned up, quick, fast, and in a hurry. And then surrounded by the black dash line was considered the non-time critical removal action. So that was a lot of the remainder that was on land to be removed. And then you can see the TVA Kingston plant, which is still there, down there to the southwest a little bit. If you go on to Google Maps now, you do an overhead view, you can see it's a very beautiful looking park, fort, and forested area. So it's hard to imagine the picture from the earlier slide being what was covering this. But so we'll move on to something somewhat different, but the Mpox outbreak of 2022. And some of the messaging and some of the way things were twisted around with that. So in early May 2022, cases of Mpox, which was called monkeypox, but has since been kind of renamed Mpox, but it had been reported in countries where the disease is not endemic. And most of the confirmed cases had a travel history reported to countries in Europe and North America rather than West and Central Africa, where the Mpox virus is endemic. This was the first time that many Mpox cases and clusters had been reported concurrently in non-endemic and endemic countries in widely disparate geographical areas. So you can see from the standpoint of the World Health Organization, this was quite the challenge, and it's on the heels of COVID-19. So you're also dealing with a public health infrastructure that is pretty exhausted by this point. But unfortunately, social media and played a role in hurting the Mpox response in a lot of areas. So in one analysis of 153 of the short form videos of TikTok, Facebook Reels, and those kinds of videos, they kind of binned those videos into 11 different conspiracy theory threads. surrounding Mpox and the Mpox vaccine. Everything from, this is a punishment from God to certain individuals trying to plant microchips through the vaccine to track people. So one of the outputs of this particular research study, though, was that they saw that these conspiracy theories, which usually operated on the fringes of society in years past, but they got 70,000 likes and over 13,000 shares, and nearly 1.5 million views. And that is actually a fairly large rate of likes and shares, with the shares being sort of like a very good indicator of how much people are believing this. You tend not to share things, at least not generally on your social media feed, that you don't believe or trust in some way. And the other thing is then people are sharing that, and people that trust those people are then sharing it farther. And you're more likely to believe something that is shared from. There was not nearly that many shares and likes from government sources. So moving to slide 16, additional research that I came across came up with this idea of a messy framework. So one of the problems, perhaps, of the public's perception of government-produced information is like how sanitized it looks. Public information officers go through a rigorous process of developing a message, having it approved, having it edited for clarity, and by the time it's released, it's been looked at by so many people. The legal folks have looked at it, and it also they tend not to release messages that aren't part of some overall larger strategic plan or SOP. Problem kind of becoming that's people aren't responding to that as well anymore, and they're responding to something a little more messy, because of social media and the way that is done, and the way that information is being shared. So and a lot of times these problems themselves are often messy and unplanned, and by the time the information is being approved and sent out, it might be a little bit stale, and so that is creating a lot of problems, and it makes it hard to focus on that messaging when that information is changing so much. And I kind of touched on this, but you have some staffs that may not be as social media savvy. They came in at a time where email was almost like a new thing, and being able to email a large group of people was newer. And now, 25 years later, we're looking at social media and how that plays. And then, of course, once you lose trust from anybody, it's just so hard to regain that trust. And often the misinformation and disinformation is louder and sounds more believable in many cases. Because people are very often questioning the government's motivations behind certain things. So it's complicated to develop a strategy in this messy environment, and there are a lot of social media users who may actually kind of prefer this messiness, as I said before, and so there is a way of kind of creating a messy framework that you can utilize, and so what? Or I'm sorry, let me go back to that. I'm back to slide 16. So some of that just comes down to, who are you going to trust to push out this information, and how is it going to happen? And there is some research out there that suggests that government emergency managers and PIOs, that they reach out to social media influencers in their area and create partnerships. Now, again, it's going to be difficult, and it's going to take more time. But if you can have influencers, kind of supporting what you're saying, it's going to go miles and miles farther. In the early days of the COVID-19 pandemic, the CDC was putting out guidance, that basically came down to wear a mask and wash your hands for at least 20 seconds. And there was plenty of Hollywood stars that, quote, did their part to push that message and show themselves washing their hands for 20 seconds. Hey, even I'm doing it. And so that actually had a little bit of a positive impact. I think once the pandemic drug on longer and longer, that lost its luster. But things of that nature, not necessarily Hollywood stars, but even the young up and coming TikTok influencer, maybe somebody we should be looking at, how do we partner with this person to spread information in a positive way. So what can we do if the social media consumer is not accepting information provided by government agencies? What else can be done? And so I found the one answer to that in a pretty unlikely place, and that is with syphilis. But more specifically, moving on to slide 19, titled Targeting Messaging, a Success Story. More specifically, as I said earlier, the response from Monongalia County, West Virginia, in the 2019 to 2020 syphilis outbreak. So this was interesting, and it would only work in something like this where there's a targeted population. I think in a larger scale, natural disasters such as a hurricane or flooding or something like that, it would not work. But in this particular case, you had a county with a population of about 100,000 people. It has a major university located within the county in Morgantown, I believe it's University of West Virginia. And they noted an outbreak of syphilis in the spring of 2019. And they started to figure out the demographics of this outbreak. So it was almost exclusively among men 24 to 28 years old. And they found out that a lot of them were meeting up anonymously through dating apps. And in this case, many of the men were from the LGBTQ community. So it's men seeking out other men through these dating apps. So the county health officials kind of were putting their heads together and trying to figure out what can we do about this? How can we get this population informed about what is going on and stymie the growth of this or the spread of this disease? And it was actually a young intern who brought up to them, well, they're using dating apps. Let's try to partner with some of the dating apps. And of course, some of the older folks there, and this is from the folks in the Monongalia County Public Health Department, so that I'm getting this from. But so they were like, well, what dating app? Like, how would we even know what dating apps to use? So this intern came up with a list of dating apps that are used by that community. And they reached out to many of them, and luckily Grindr responded favorably. And Grindr is actually a dating app for the LGBTQ community, and it's one of the largest and well known in that community. So they were able to get with that app and create a geographical warning message that anywhere within a certain distance of the county center, essentially, if you logged into the app, you would just get a quick warning that would say, hey, there is an outbreak of syphilis in this area. Be careful, and if you need free testing, please, you can come here, and it's anonymous and it's free. So moving on to slide 20, titled Results. So the first message was sent to Grindr users on April 24th, 2019. And in that first 9 hours, 5,000 people saw the message. And interestingly, 12% clicked, and that's actually a huge rate for that kind of campaign. The message eventually reached 66,000 unique individuals with a final click-through rate of 7.16%. So click-through rate is a common metric that is used in deciphering your social media impact. And for comparison, though, the YouTube average click-through rate for government and advocacy is 0.07%. This click-through rate of 7.16% is literally 100 times greater than that. So it just really goes to show that targeting that specific population in a novel way really reached those people the right way. So the right people got the message. Uninterested parties could not really launch a social media campaign and counter the government messaging, because Grindr was probably considered a social media type of app. I guess you could classify it as that, but it's not like Facebook and Twitter where you could send messages and post it on a board and people can share it. It's not that kind of app. It's more of a communications app. And many did seek testing as a result of the campaign. And, maybe it's a little hyperbolic, but I believe that lives were definitely saved by this. So a big success story in targeting your communications. So the audience kind of is everyone. So one of the things that we can do is, again, as I said, partnering with influencers. So on slide 22 now, influencing the influencers. So partnering with those people who are heretofore untapped, those social media influencers. And again, that's from my perspective. There may be people out there that are working with social media influencers. There is a kind of interesting product from the U.S. Food and Drug Administration that is called Influencers 101, and best practices and practical approaches for public health campaigns. And it actually comes from the Center for Tobacco Products, because they had a lot of success in getting people to quit smoking, and they used some of the who influences your decisions to quit smoking. And so it's an interesting read to go through and see how that was impacted. Again, there is that longer term or less time sensitive component here, whereas if you're in emergency management, you need to get information out quickly. So that is a little bit of a difference, but I think it would be instructive to find out how they partnered with influencers. So using the messy framework that I just was talking about, and control the narrative without directing the narrative, if that makes sense. So what I mean by that is you can control what information goes out and just kind of guide, but not direct how it gets out there. So you using those influencers, using those people that are going to spread your message, and they are a great way of serving as a network in minority communities in ways that governments may not, and minority communities and any community that is not going to necessarily trust what the government's putting out there. And one of the things that led me to want to do this presentation is that I find that the public health community overall, by and large, is trying to do the greatest good for the greatest number of people. And everybody I've talked to in the public health sphere has those goals in mind. Most people do not get into that field because they want to make millions of dollars. They get into that field because they want to help people. So it is probably very frustrating to a lot of people that there are citizens out there not trusting their messages when they are trying to do the best possible job. So there's a quote from the FDA that an influencer should not be viewed as a spokesperson for your organization, Rather, influencer programs should be viewed as any other media tactic that could be used within a communication plan. So, again, incorporate this into your communication plans, but come up with a method where these people aren't speaking for you, but you are passing your message through them. I know that's easier said than done for sure, but it is kind of a way forward. So a few other things that have come across now on slide 23. Say saved rounds. You don't get to shoot saved rounds if you've ever shot on a range, but so I'll just discuss them real quick. But again, I said we did a lot of exercises in exercising and tabletopping refugee camp scenarios. And again, the messaging is critical here. And in one of our scenarios, we had multiple different groups that were coming to one camp. And so it really, the importance of targeting that messaging to those specific groups, whether that be their religious identification, their ethnic background, their gender, their age, medical needs, that is so important. There is a great amount. The avian flu, a lot surrounding that outbreak, was actually very well done, and and how the government responded, and in some cases had to cull the herds of farmers, and how they got the messaging out to those farmers. It's an interesting read to discover that. And then the final three, much more well-known probably, the 3 Mile Island partial meltdown of the reactor there in Pennsylvania. One of the big things there, it was, and it is unfortunate that he was put in this position, but the governor stayed in Harrisburg, which 3 Mile Island was very close to Harrisburg, and the governor refused to leave, and that was his way of just trying to settle people down and calm people down. And he looked at, one of the things he looked at was what would be the cost of an evacuation, and almost any evacuation is going to cost lives, especially when you have people in hospitals that need to be evacuated, or retirement communities. It's going to create havoc, no matter how orderly it is. And he decided that the best thing was to stay put. And that was his way of messaging that, hey, we have things under control. And luckily, in the end state, it worked out. The Johnson & Johnson recall, Johnson & Johnson Tylenol recall, many people in emergency management and crisis response are very familiar with this. But in this case, it kind of went the other way. And Johnson & Johnson realized, hey, we need to pull all Tylenol off of all shelves and tell anybody who owns Tylenol, manufactured after this date, not to take it. And they went and they took a huge risk in putting that information out there, because your company could potentially lose a lot of credibility. But it had the opposite effect in that they said, hey, something happened here, and we don't want anybody getting sick or getting poisoned from it. So pull all your Tylenol, don't take Tylenol that, with these line numbers, these dates, and again, potentially saved lives. And then the COVID-19, again, that is really where misinformation and disinformation reared its head. But there also was a component of some differences in messaging from the government. And, a lot of it was managed by state and county governments. So that's where some of that comes from, is you had the county officials saying one thing, people from the next county or next state over saying another thing, people at the federal level saying a third thing. It became confusing for the country at large. But I think there was also a component where, as more information became known about COVID-19, that was it maybe was not passed in the best way. That, hey, now that we know, you no longer have to spray off and wipe down your hard surfaces, and when your groceries are showing up, you don't have to spray Lysol on them anymore. And some people were doing that. It's not staying on those surfaces. Well, months later, I still had people say like, oh, you got to wipe that down because COVID can live for however many hours on a hard surface, even though that had been kind of disproved. But early on, it was thought to be the case. With that, I will go ahead and same picture of me from earlier. But I'll go ahead and take any questions or comments that folks may have. I'll go ahead.
Thanks, John.
Sorry, these are some of the. I'll put the references up here real quick, just so some people can see where I got a lot of this information.
Sounds good. Definitely an interesting presentation. The chat has been very active and very lively, which kind of speaks to the topic that we had today. A lot of comments, not as many questions, but overall, before we go into the Q&A session, we do know that some people are having technical difficulties viewing the chat. The slides are available right now on the HDIAC website. You can go to today's webinar announcement. That link has been pasted into the chat to download the slides. And also this will be recorded as well. So feel free to check back if you want to see the slides in time with what John was speaking about. But with that said, we'll open up the Q&A. First question we have from Lance. He says, wasn't a big problem with COVID is that the government messaging changed as we learned more, and a lot of the public had issues with this change in guidance.
Yeah, and I kind of briefly said that at the very end there too, so we probably asked the question before that. But that was a huge issue that we saw with the COVID response. And when we were doing research about, what the Army's response in this kind of scenario should be going forward, was that as information was being learned about COVID-19, it was getting put out there. And I won't even say it was haphazard, but it was difficult, and people were not absorbing the message that, hey, we said this 3 weeks ago, but now we have learned through study and analysis and research that was not the case. Now, you should be, like I said, you no longer have to sanitize your groceries when they show up and things like that. And I remember seeing social media posts that was kind of going around, hey, if social distancing works, why do I need a mask? If my mask works, why do I need to social distance? And I think the message that these are mitigation strategies didn't come across clear. People saw these as prevention strategies, and nothing or very little is going to truly prevent the spread of a disease like COVID. But the mask and the social distancing could help mitigate that spread largely. And somehow that got lost. And unfortunately, I don't have a great answer to how that could have been done better. People, it kind of got a life of its own, which is unfortunate. But yeah, that's a very good question.
Thanks. Next question from Lauren. How do we improve trust prior to a crisis communication situation?
Yeah, that is a great question. I think that is going to be one of those things where if you can link up with those influencers, whoever they are, and an influencer does it. There may be different perceptions of who an influencer is. It does not necessarily have to be what might be in your mind as a social media influencer, but it should be somebody in your area that can influence folks, and perhaps coming up with some sort of way of establishing that trust with them early on. Now, what some people may see that negatively, like, oh, now you're just parroting what the government's going to say. I'm not going to listen to you. Saying that to the influencer. But ultimately, if there was some way of saying having an influencer highlight the fact that, oh, hey, this county in Illinois ran this exercise to make sure that they could respond well to this type of incident. Isn't that awesome that all these first responders are out here on the ground protecting us, or something like that? might be a way to start building that trust before the incident. There's probably other ways, but I think if you could get the influencers to somehow build up a little bit of that underlying messaging, that might help. I don't know if that's hopefully that's a good answer to the question, but thank you for it. It's a very good question.
Thanks. Our next question, I believe I'm interpreting this correctly, says, do you have to foresee the message content impact while keeping in mind the stereotypes as well?
He said, do you have to see the message content impact?
Do you have to foresee the message content impact while keeping in mind the stereotypes as well? Gabriel, feel free to clarify in the chat if we are misunderstanding what you typed there.
Yeah, but I do see the I don't fully understand. So Gabriel, if you can put it in the chat, I got the chat opened up here, but yeah, I think there is a definite having in mind have see the message content impact. I see the question that where he posted in the chat. So I'm not sure if stereotypes is the best word there that you're unless you're talking about people's stereotype of government messaging. But yeah, I think you do need to foresee the message content's impact, keeping in mind who is going to see the message and who you are targeting to see the message. So again, for example, with the Kingston coal ash spill, I think there was an idea that this is only impacting that local area. Well, anybody that lived along those rivers, especially downstream, was impacted as well. So it became in that area, it became much more prominent than I think a lot of people realized. And there was I don't know that there was stereotypes involved, but there maybe when you are discussing where that coal ash was trucked to, and sort of that I did mention sort of a stereotype or an assumption that these people are of one mind, and maybe they won't even know that the coal ash is going there or something. Oh, a kind of compiling message either. Oh yes, Gavril in the in the chat he typed a kind of compiling the message to suit their cultural perspectives. For example, the refugee camps. So yes, that was huge. So again, I don't want to go down the road of saying stereotypes necessarily, but you do have to take into account those cultural perspectives, which are going to be it's a type of stereotyping, I guess, in a way. But you are going to take that as a broad guidance for your messaging. But I will also caution that in a lot of these cases, we found that the larger, broader message didn't land with everybody, because although you can take some cultural interpretations of how, let's say, a Muslim Arab population is going to respond to a certain message, you can paint a broad picture and that be correct for a lot of people, but there are going to be people in that population that it does not land with. And there's a lot of discussion in many countries where there's differences in culture and how they treat women. Well, maybe not everybody's treating women that way, so, in that culture, or maybe it's even worse than you realize, and there's some people that it's alienating for that. So while you can have a broader message that's based on what you understand from the cultural perspective, there still needs to be some more targeted information and methods to get it out to people that that otherwise might not be impacted. And it's huge in public health. You know, to not have, or in these refugee crises, not to bring like some sort of cultural elitism, like, oh well, this is how we do it, this is how it should be done, to really understand how it's done in that culture. So I hope that answered the question. Um, um, and actually, a great message I just saw posted in the chat. Very true. Public messages need to be written and stated at an 8th grade level to stay away from technical terms and acronyms. And I believe maybe even at a slightly lower level, but yes, 8th grade level, great benchmark. That for people to understand that. But Phil, was there any other questions that you saw pop up?
Yeah, we're right at 1 o'clock now. So the last question for today from Kimberly: is there a current monkeypox response plan or recommendation in case it emerges more in the U.S. in 2025?
Yes, I do believe there is. I know that the World Health Organization and the U.S. Centers for Disease Control and Prevention both do still have mpox resources posted. I'm not sure that if there is a holistic plan out there, but that is something I would definitely, please shoot me a note if you're interested in trying to find that, and I can help track it down. Um, uh, but yes, that is definitely something that since 2022 has been on the forefront.
Perfect. Thank you. I think that addresses all the comments today. Very interesting, fascinating topic, relevant to things that we see today, whether that be just your regular media and the politics and the election and misinformation and disinformation. As a cyber guy sitting in the room, lots of times we look at technical ways to kind of fix problems and using cryptography and hashing to kind of verify that your software updates are correct or things like that. That could possibly be something that some of these government agencies can use to kind of verify the authenticity of some of these messages. However, if there's a lack of trust from some of these government agencies, that's a whole different issue. So very, very important conversation. Please check back to the HDIAC website for the recording, which will be posted within a couple of days, and you can download the slides tonight. But thanks, John.
Thanks a lot, Phil.